Good afternoon. My name is Kevin, and I'm here to talk to you all about CPAP machines and other remedies for sleep apnea. Why are continuous positive airway pressure or CPAP machines important? And which respirators should patients use if they have sleep apnea? Are there other remedies? Yes, to correct sleep apnea. Sleep apnea is a common disorder which affects a lot of people, and it requires the use of CPAP machines, respirators, and or surgical procedures. We will talk about the components of CPAP machines, those respirators, and the surgical procedures. So CPAP machines have become more advanced within recent years, and according to Wicklin, CPAP machines can now be tracked through cellular towers and wireless networks. Prior to this advancement, patients would have to take the entire system CPAP machine into a doctor's office to get their sleep progress and data tracked, or pull off the machine and or SD card to track their progress. There are different types of respirators, and according to the Mayo Clinic, the most commonly used respirators are the full-face respirator or mask and the nasal mask. During a phone interview I had with a friend by the name of Jonathan Shiflett, he said that he uses the nasal mask as it allows him to feel less constricted when he's sleeping, and that only comes over the head and plugs into the nose, and he can move around easier. I use the full face mask as I sleep with my mouth open most times. So this allows for the pressure or the air coming from the machine through the hose to push the air through my nose and my mouth to open up my airway. Now what sleep apnea is, it's a disorder which the tongue blocks the airway when you're sleeping, and it causes people to stop breathing. So what this does is the machine pushes the air down through the airway, keeping the airway open constantly and providing the air needed. In another phone interview with a friend, Oladapo Ogunbaye, he stressed the importance of cleaning the machine and ensuring that all components are working properly. So the mask, whatever mask you are using, should be cleaned with warm soapy water daily. The tubing and the air filter need to be cleaned weekly, along with the water container for the humidifier. Now this water container, these machines use distilled water. If you are in a bind, you can use regular bottled water. So when you're using the bottled water as opposed to distilled water, you will get more dirt and gunk back up in the hose and the air filter. Located in the same compartment as the air filter is the SD card, which tracks all your information, and here's the control panel and power panel. This is the AC power cord that plugs everything together. When plugged in here, and this plugs into here. It is imperative that you make sure that your CPAP machine is functioning properly and is constantly cleaned. CPAP machines take a lot of getting used to for patients with sleep apnea. So there are other procedures which are called surgical procedures, and those surgical procedures, according to Harvard Medical School, a couple of them are the maxillomandibular advancement, which the doctor breaks the jaw and advances both jaw parts forward and then re-puts it back together to allow the airway to be more open. Another surgical procedure is the upper airway surgery, and this is where the doctors take out the uvula, which is located above your tongue, and removes any excess tissue around the airway. According to health.com, the aforementioned procedures only have a 20 to 30% success rate. So it's almost a no-brainer to go with a CPAP machine, as it works 100% of the time. All you have to do is plug it into power. You have power, and then you're good to go. There are different types of CPAP machines now, which are travel CPAP machines, and they're smaller, and some of them have battery packs. But again, batteries die or you don't have them charged, then you're not going to be able to cure your sleep apnea or allow you to have that air coming through. So my purpose of this brief or speech has been to educate you all on the importance of the CPAP machine, the components of it, and other remedies such as the surgical procedures which can fix or correct sleep apnea. I hope that you all have learned a lot through my demonstration, and if there are any questions right now in regards to the CPAP machine, hopefully I can answer them. Does anyone have any questions?
Are you okay?